Hey, this is Professor Fay with your anatomy lesson of the day. Today we're going to talk about the heart. So this is the anterior surface of the heart. It would sit in my chest something like this, although it's much bigger than my actual heart is. But we'll do the great vessels and blood flow. All right, so the first great vessel is the superior vena cava. You can see there's a couple of branches here. And because the superior vena cava is collecting blood from your head, your neck, and your upper extremities and returning it to the heart's right atrium. Also, if I turn the heart around to the sort of posterior inferior surface, you can see the vena cava. This is the inferior vena cava here. That's delivering blood from your lower extremities and abdomen and such back to the heart's right atrium. And then finally, if we look in the wall here, that's a coronary sinus. So all the blue blood vessels you see on the heart wall here return to the coronary sinus and to the right atrium. So all of this blood is deoxygenated. So that means it needs to go get oxygen from the lungs. So what we're going to do is send it from the right atrium down through a valve here called the tricuspid valve or right atrioventricular valve into the right ventricle. If I take the front surface of the heart off, you can see there's the right ventricle. From the right ventricle, blood will get pumped through the pulmonary semilunar valve right there, through the pulmonary trunk, and then that pulmonary trunk branches into right and left pulmonary arteries. You can see those right and left a little bit if I tip the heart. And they go out to the lungs and blood gets oxygenated. It comes back to the heart then through pulmonary veins. And so we've got right and left pulmonary veins. If I turn the heart around, you can see those better. So that's the left pulmonary veins and the right pulmonary veins. If I drop the hatch here, you can see that the pulmonary veins are dumping into this left atrium now. All right. So from the left atrium, blood is going to get pumped down through this valve. This is the left atrioventricular valve, which can also be called the bicuspid or mitral valve. It goes into the left ventricle. From the left ventricle, blood will get pumped up through an aortic semilunar valve. It's a little tough to see up in there, but it then goes into a part of the aorta called the ascending aorta. It transitions into the aortic arch, and then posterior to the heart, it would transition into the thoracic aorta. That thoracic aorta would pass through your diaphragm at the base of your lungs and then enter the abdomen. So it would be the abdominal aorta there. And it terminates right about your pelvic cavity where it branches into our right and left common iliac arteries. And then there's several more branches off of that. But that is the blood flow through the heart.